Hey everybody, Chaz Molder, Mayor of the City of Columbia, coming to you today for our next installment of the virtual town hall. As you know, we've been doing these virtual town halls over the last several weeks, really since the onset of the COVID-19 pandemic, so that we can bring information to the public. We know a lot of you have changed your lifestyles and aren't getting out as much and are relying on internet and other forms to get your information. And so these virtual town halls are trying to serve a purpose in that regard. Today, I'm very excited. We have a special guest, Dr. Alex Jahangir, who is with us. And if you see him on the screen, the face probably looks very familiar because Dr. Jahangir has been very, very active in leadership with regard to the COVID-19 pandemic in the city of Nashville, which really has had implications across the state of Tennessee. Dr. Jahangir holds several positions at Vanderbilt University Medical Center, including the Executive Medical Director at the Vanderbilt Center for Trauma, Burn, and Emergency Surgery. He also serves as the chair of the Metro Board of Health of Nashville and Davidson County, which you know governs the health department, which is charged for improving and sustaining the health of all in Metro Nashville. And more recently, Dr. Jahangir has served as the chair of the Metro COVID-19 Mayor's Task Force. So, Dr. Jahangir, I know things have been very busy for you as of late, but I want to say thanks so much for spending some time with us today.
Well, thank you for having me so much, Mayor. I really appreciate this opportunity.
So let's start first with the city of Nashville. We saw this morning on Mayor Cooper's press conference some new numbers that came out today that obviously are a concern for all of us. 608 new cases and a revert back to phase 2 of your reopening plan. Just if you would, briefly in your own words, give us an update on all things Nashville.
Sure. So thank you. We over the past week have started seeing 2,100 cases, new cases, 608 of which, as you mentioned, were just over the past 24 hours. And so that is staggering. I just want to be very clear. That is not where we want to be. But I will say this: when we did our reopening plan, there were really 6 metrics that we were following. Hospital capacity, public health capacity, so how many contact tracers we have, testing capacity, and then rolling average and transmission rate. And I mentioned those metrics because throughout this entire process, Mayor Cooper has always, when I first took this role, said he wanted to be data-driven and have the public health experts and medical experts give him advice and then have the data to prove it, and then he'd make decisions. And that's what he's done in the past 4 months. So one thing I'm really proud about in Nashville, I think is very important for Columbia, is our hospital capacity for our region is really strong. Right now, we're sitting around 20% of ICU beds and hospital beds are open. In fact, this morning, there are 148 people admitted to Nashville hospitals with COVID. That 148 takes up about, a pool of 3,000 plus beds. So I want everyone in the region to know our hospital capacity is really good right now, which is important for all of us, not just here in Nashville. And that's not even including the surge planning that is there in case we need it. So that's really important to realize. The other thing, at least in the city of Nashville, is, and now the state is doing too, is we're able to test really extensively. Last week, in the past 7 days, we've tested about 13,000 individuals in Nashville alone. Now, if you add what you're doing down in Murray County and other regions, I mean, I think Middle Tennessee is doing a really good job of testing, and Tennessee should be commended with what the Commissioner Pierce and Governor Lee have done in testing. So that's really positive. And then in Nashville, our contact tracing, we have a team of over 125 people who called cases and so forth when it happens. And this infrastructure we built is what's led us now to what the news we announced today. Our rolling 14-day average had been slowly trending up. So we were in the hundreds. And then over the past, as I mentioned, 4 or 5 days, we had over 2,000 cases. So our rolling average has jumped up 76 more cases per day over the past week, averaging now about 209 cases a day. The reason this matters is this becomes very quickly, goes up very quickly, and those people from our contact tracing, we know, interact very closely with at least 4 other people. So that 600 cases today may have probably already interacted with 2,400 other individuals. And so this can grow very quickly. The other thing our contact tracers noticed, they called me Friday afternoon and they said, hey, we're noticing something different. These new cases are all younger. They are of a demographic that we had not been seeing. So essentially there were younger, young professionals who were mainly hanging out at social gatherings or bars or floating down rivers. And that's different than what we've been seeing in Nashville. So because we had this public health infrastructure, we were able to recognize quickly that there's something going on here that's different, and we acted. So that's the real quick spiel. Like, get into the mask if you want, because I can tell you the steps we've taken. But that's kind of where we stand right now, and I can go from there.
Well, I appreciate that. All very good info. I definitely want to talk about Facemask, which we'll do here in a second. But you mentioned a couple of things. First of all, regarding the hospitalization rate, like you said, that's been one of the metrics that I keep on wanting to know more about. Obviously, Nashville is able to have additional information than in some cases more of the rural counties do, but certainly hospitalization rate is important. We see what's happening in Texas, particularly in Houston, where they have a very significant problem there, primarily based upon hospitalization. You also pointed out the testing. One of the areas that Tennessee has really been a leader with regard to the COVID-19 pandemic is the ability that we had very early on to test. And so since you brought up testing, let me just ask you from a medical perspective, what do you say to the person watching today that may be debating whether or not to get a test? Why should someone get a test?
Well, so I would say, as Governor Lee will say, if you're worried about it, get a test. One thing that I do appreciate is how open we've made testing in this state. A lot of other states, you have to have symptoms, and maybe as a public service announcement, remember the 5 symptoms are cough, shortness of breath, fever, loss of taste or smell, and diarrhea, believe it or not, which almost sounds like every other illness. But if you have any of those, get tested. But let's say you're worried. Let's say you came into contact with someone that may have been infected, but you don't meet that criteria of being a close contact to that person. Let's say you're been in a large crowd, or you want to go visit grandma. Those are all reasons that people are getting tested these days, and I think they're all very valid reasons to get tested. The test is relatively pain-free. It's, you get results pretty quickly within a few days now. And I think it just adds extra peace of mind. The reason to have the test, so I think maybe further, if I can take your question a different way, is some people say, well, if I may have the virus, there's no real treatment. Why would I bother getting tested? Well, it's important to get tested because if you do have the virus, first of all, it's important to know that so that your close contacts can be called to mitigate any spread. Additionally, if you have the virus, you can slowly deteriorate and then all of a sudden very quickly deteriorate. So I actually bought a pulse oximeter. You can buy from Amazon for like 20 or 30 bucks. You put it on your finger and it tells you what's your oxygen level. Because I just assumed if I ever get the disease, every day I'm going to check that and make sure that I'm oxygenating well. Because what we've seen in this virus is you're doing okay, and then you're not doing okay. So if you know that information by getting a test, you can be a little more vigilant of how you take care of yourself. You may not change the course of what you do, but it very well may, and that's why it's important to get a test.
Very, very good advice there. I want to get in a little bit to Columbia and Murray County, and then also your perspective from the state as a whole. But before I do that, I think something that's important that you might be able to explain better than anybody. We've seen throughout this where the governor has been able to have the sort of direct control over 89 of the counties with respect to executive orders and certain restrictions and prohibitions. But he's left some autonomy to 6 of the counties in the state, including Metro Nashville, which has their own standalone health department. Of course, as I mentioned at the top, you are the chair of the Metro Board of Health, which I believe governs the Metro Nashville Health Department. So can you sort of describe the process or the how and the why that the 89 counties are sort of subject to one jurisdiction, whereas there are 6 counties that have a standalone, so to speak?
Sure. I think there's probably a lot of sausage making that was done way before anyone watching this came to, right? But here's the gist of it. You're right. There are 6 counties, Shelby County, Hamilton County, Knox County, Madison, Davidson, and I believe Sevier County.
That's right.
That for whatever reason, years ago, the health departments of the county were given autonomy from the 89 counties that report up through the Commissioner of Health for the state. Now, fascinating enough, of the other 6 counties I mentioned, Nashville's the only one that the city and the county are aligned. Nashville, as just Nashville history here, health was the first part of metro government that got consolidated in the 60s. And the way it is the Department of Health actually reports to the Board of Health and not directly to the mayor. So it's really fascinating. Just again, I'm sure old fun history of figuring out how that's done. But with that said, the 6 counties have autonomy. Their health departments don't report to Commissioner Piercy. obviously, we have to be strong partners with our state. So Commissioner Piercy and I speak very regularly, as I suspect the other counties do, with the commissioner. But because of that, it allows us the autonomy to declare a public health emergency, for instance. And a public health emergency under state law then allows certain powers, such as being able to mandate masks or close restaurants or bars, or do some of the things that we've been able to do in Nashville. But I think what is critical here, Mayor, is we're a regional economy. And so 700,000 people in Nashville is not what the MSA of Nashville is, right? There's people coming from your county to us. There's people coming from our county to yours. Williamson County and you guys, I'm sure, have a lot of people coming back and forth. So I think, and Commissioner Piercy and I and others have spoken about this, really a regional approach at the minimum makes a lot of sense. But there are lots of rules around that, and I think Governor Lee gets that, and he hopefully will work through some of that, and I think he will. But it does allow Nashville proper to have a lot of autonomy early on to declare a public health emergency, which had already been established under state law with the powers we were granted to do that. And so that's allowed us to be really ahead of the curve, frankly, in the Southeast, if not almost in the country, of some of the stuff we've done.
Yeah, you're right. I know that just a lot of things that happens in Nashville, some of the folks in Columbia are questioning, why can't we do that? Or why aren't we already doing that as well? And so I think your example there of the distinction between the standalone versus those governed directly by the Tennessee Department of Health is very helpful, and certainly appreciate that. Before we get into the face mask mandate, though, I do want to talk a little bit about Columbia. Obviously, you have been extremely sort of informed throughout this process, specifically regarding Nashville. But medical professionals like you are always looking at data and are looking at numbers, and I'm certain that you've taken a look at what's happening regionally and across the state. For the city of Columbia, today we saw 14 new cases. We don't know the recovered cases yet. We anticipate we're somewhere around 130 active cases in Murray County. We know as a state we saw another 1,500 new confirmed cases, which was the second highest day ever. So there's some trends really that Nashville is seeing that we're also seeing here locally in Columbia, but also across the state. What's your outlook to the extent you do have some specific Murray County data, and then also the state as a whole?
Sure. So I think what is important, and if I don't know if I can share any in my screen. I think what you have seen is, am I able to share my screen? I'm sorry.
No, you're fine. I don't know if I have that on, but.
All right, don't worry about it. So here's the thing, Mayor. I think those numbers you mentioned are exactly right. The state of Tennessee Department of Health, so you can just Google state of Tennessee COVID data. They have a dashboard. And what that dashboard will show you is that for Murray County, you are seeing, and it goes daily cases, it is going up. This is not there's no flattening of the curve in Murray County, just as there isn't in Davidson, just as there's not in Williamson and Rutherford, and obviously not in state. We, as Middle Tennessee region, we are doing not as well as we were. And this is probably not the best way to show this, but I do want to show one map that just came out from a study in Harvard, and it shows Tennessee. Okay, and I'm sorry, this is totally a rudimentary way to do this, and there it is.
Oh, there we go.
Almost had it. Hold on, I'm sorry. Oh goodness, oh, that's my kids.
We like to see kids too. It's all good.
All right, this will work. I promise. Maybe there you go. Oh gosh darn it, I had it. Well, for that one split second, that's not really working well. So there you go. The red is Davidson County. The orange are surrounding counties, and you can see those are new cases per day. My point of bringing that very hard way to see, that's actually off globalepidemics.org is where that chart's from, if you want to look it up. Is what you're seeing is, yes, Davidson County is red, but everywhere around Davidson County is orange, which means and that's number of cases per 100,000. So what's great is it really equalizes across the entire country. You can zoom into all parts of the country and look at the number of cases per 100,000 and get a sense of where your community is versus someone else. All of Middle Tennessee is not good. Let's just be honest. And what we have been, I guess, fortunate, maybe to the wrong word, but what we've been fortunate here in Nashville and in Tennessee is the people getting this virus a majority of them are under the age of 40, and most of them are healthy. Our mortality rate in Davidson County is 1%. I suspect yours is probably maybe somewhere similar. I will say that I give the state and local municipalities a lot of credit for making sure this doesn't get into nursing homes. That's when you really saw big problems in New York and Washington State. But there is nothing to say that all these new cases, which are still younger people, won't go home, infect their grandparents, and in 2 to 4 weeks from now, those grandparents are going to get really sick and go into the hospital. In Nashville, 10% of those who get this who are over 65 or 75 die, not get sick, but die. So 10%, 1% mortality overall, but 10% of those over, I believe it's 65. So that is another reason why it's important to get tested, because if you know you have this virus and you're 40 and yeah, it kind of sucks to be sick, I mean, heaven forbid you get that to your elderly grandparent or your older parents. And that is why we have done well as a state, I think. But as these numbers go up, I worry a certain percentage of those are going to translate into mortality, which is just really heartbreaking to think about.
Well, and we talk a lot about our children. I know you have kids, I have kids, and that's something that's obviously always on our mind. And one of the common questions we've been getting lately is what's going to happen with the upcoming school year. And this week we saw the TSSAA put out some information, at least with respect to athletics, which of course is different from the academic calendar, but obviously all of that is being considered. I know you've been involved in several conversations in your capacity as of all things Metro, including with Metro schools regarding what they're going to do. And we saw yesterday the American Academy of Pediatrics release a report that basically says that the overall well-being of the child is to get this child back into school in the physically present type of way. So what's your take on that?
Well, I think you're right. It's a tough question. About a month ago, we brought together a panel here in Nashville that brought private, parochial, charter, and public schools together, as well as with health experts to write recommendations. And we wrote about a 30-something page report of a kind of a floor for everyone to base on, because I know your community also has those players. And because I think each school system has its own unique needs and challenges. And what I'm really happy is the American Academy of Pediatrics report, which is a very thorough report I encourage your people to read, really reconfirmed what our study said, and the gist is exactly what you said. Well-being of the child, schools should ideally be open if possible. Here are the things that we seem to think we know, and I say it like that because we learned so many new things about this virus. The transmission from a child to an adult seems to be low. Transmission the other way around also seems to be low. For the most part, kids do well. Thank God, so far in Nashville, at least, no child has died. Nobody under 40-something has died in Nashville. There is this Kawasaki's-like syndrome, so it's called a vasculitis. There's a certain reaction a very, very, very small percentage of kids get, who've had COVID. I don't think we've had any in this region, but if we do, and you get to it early, and really the symptoms to look for are high fever and rash, and you get the person to the hospital, there's ways to treat it. So the really bad parts of COVID that may happen to young kids, thank God there's treatments for it if you recognize it. But I think what I would approach to opening of schools is it really has to be a decision amongst the school systems. And it's also probably going to be an 80-20 type rule, right? There's going to be a solution that's going to work for 80% of people, but there's kids that have medical conditions that it probably isn't worthwhile sending them, or maybe there's teachers that have problems that they shouldn't be exposed to high risk situations. But school won't be the school you and I knew last year, right? I was really excited this year. My oldest will finish 4th grade, and I have a younger one, and they do this turkey thing at Thanksgiving, and they all stand together. Well, that's not going to happen this year because it doesn't make sense to have assemblies like that. They may not do field trips like they used to. They may not have circle time like they used to. But at the end of the day, like you said, Mayor, recommendations right now are to get kids in school if possible, if it's safe, and then recognize that, but you need to have a clear, transparent plan that everyone knows what happens if a kid gets sick, because more likely than not, some kid's going to get this disease. And if you don't have a plan, then it's not going to go well. So you need to make sure everyone knows what the plan is. Somebody gets sick, you do the plan as you said. If you make modifications to a plan, everyone needs to understand why those modifications were made. And I think that's how we'll proceed. I don't know what all of Nashville is going to do because we have so many different people. But I think we'll get to that point soon.
Yeah, that's really interesting information, and I think you make a great point among many. But when you say not only do we have to worry about how we get the kids back in school, but also making sure you have a contingency plan for when you have a confirmed case in the school, because at this point it seems inevitable that there will be confirmed COVID cases continually for the next several months, and that's schools are not going to be immune from that. So it's important that we all have plans in place for when that does happen. Let me just close now on the final topic I've been wanting to talk about, and regarding face mask. And one of the things I mentioned early on to you is some of the confusion well, the city of Nashville just recently passed a face mask mandate. The mayor announced it, and Molder, why can't you do the same thing? And that goes into sort of that autonomy regarding what the Metro Health Department is able to do versus what some of our local county health departments are able to do. And not to get in the weeds there again, but let's just talk about the importance of masks. Obviously, the board that you chair passed unanimously the recommendation for the face mask mandate. So clearly, you have some strong feelings on face mask and the importance. So what do you say about a face mask for somebody that might be a little bit uncomfortable in wearing one in public?
Yeah, so I think that's right, Mayor. I think we, for a long time, were strongly encouraging them. And then I started seeing these numbers creep up, and I realized as a municipality, one of the last levers that we have in Nashville, and for the reasons we talked about earlier, is we're one of the, probably the only city in the whole state, because we have a combined metro county, city county government, that we could do it probably a little easier, although Memphis and Knoxville have now passed them. I felt that was a lever we could pull quickly, and we did on a Friday afternoon because the cases were going up. As I believe I mentioned, or if I haven't, I apologize. There's studies that show if 80% of a community wears a mask, the infection rate goes down by 1/12. There are studies at Health Affairs just came out that showed the 15 states and the District of Columbia who have had mask mandates have seen a decline in infection rates as a direct correlation with time away from having the order placed in place. Or I'll use an example of Japan. If you look at Japan, and I think we talked about this, or I forgot which conversation we had, but if you look at Japan, they've never gone on lockdown. And this whole coronavirus thing, because Japan is a country that has been wearing masks for a long time, whether it's bird flu or just regular flu, and they don't stigmatize it. They still ride their subways, they still do everything. So we really got to get over stigmatizing masks. I'm a surgeon, I wear a mask sometimes 12, 15 hours a day. I've never had CO2 poisoning. I've never carbon dioxide poisoning. I've never passed out. I've never grown a third arm. A mask is a way to protect your neighbors. What I love about Columbia, and I spent a lot of time in Columbia. My closest friends live down there, and love Mule Day. I hate it was canceled this year. I really had plans to go. I even changed my whole call schedule so I can attend Mule Day. So for the record, I was really sad.
We'll see you back in 2021.
I will be there. But I tell you, the times I spend in Columbia, just like a lot of places in Tennessee, people care about their neighbors. You want your neighbor to live. There's some really wonderful older people in Columbia that I've met. Listen, wear the mask. This should not be a politicized thing. If you want to politicize it, put something on your mask that politicizes your opinion. I welcome that. But please, this is probably one of the easiest ways we can help be safe. And that's really important for me to just emphasize. And I think the governor, gets that message. I think the reason I'm so excited to be on with you is, as I mentioned at the beginning of this, we need to take a regionalized approach to handling this. That picture you sort of saw for a second, it's not just Nashville. Nashville may be in the red, but guess what? Nashvillians are coming to Columbia, and Nashvillians are going to Williamson County, who are then going to Columbia, and vice versa. We need to approach this as a region. I would love for it not to be a mandate that people just wear masks. You can just wear them, but get the message, guys. Let's make this happen. Let's get this virus down in our community so we can all have Mule Day in 2021. I'll be there. So was it like April 1 or something like that?
That's right. April, the first Saturday in April.
I'm there.
We'll hold you to that. We'll make sure you're down here having fun, mask or no mask. Hopefully by then, maybe things will be a little bit better than where they are now. But you make a good point, Dr. Jahangir, and I want to sort of close on this. Really, one of the primary reasons I wanted to have you today, in addition to the medical expertise and just the leadership that you've been displaying over the last several months in your capacity as an advisor to the mayor on this and your other medical capacities is, so goes Nashville, really so goes all of Middle Tennessee. And that's economically, certainly, but also medically. I mean, in Murray County alone, we have approximately 10,000 or so of our residents that commute daily to either Nashville or Williamson County for purposes of work or for purposes of medical appointment or schooling or otherwise. And so not only do Nashvillians come to Columbia, but a lot of Columbians go to Nashville on a daily basis. And so when they're going to Nashville and then coming back, they're bringing what they interact with back home. So it truly is, as you say, a regional approach. And as you mentioned, the governor and Dr. Piercy and others at the state level have been promoting masks now very vigorously over the last several days, particularly today on the call with the governor, who made a point of saying, wear a mask not for yourself, but for your neighbor. And I think that's certainly the message, the positive message that y'all have been saying, and certainly the message that we're promoting in Columbia. And I think we're seeing a lot of momentum with regard to the mask, and certainly do appreciate your leadership in that regard. So with that, Dr. Jahangir, I know you're a very, very, very busy man. We appreciate your leadership, what you're doing in Nashville, because not only are you helping the city of Nashville, you're also helping all of Middle Tennessee when you do that. So thanks so much for joining us. And we hope everybody has a happy 4th of July. And thanks for tuning in for this virtual town hall. We'll see you next time.